The truth is that in the next couple of months, I do expect that the market for vaccines will free up a bit as countries that have been able to hold on to what they have because they have the production base or the manufacturers begin to provide sufficient to their population as they struggle with vaccine hesitancy, as we will too. You're going to find that they are going to have to stockpile. And my anticipation is that you will soon see more vaccines on the market, reliable and safe vaccines, and maybe even some gifted to us, which we will appreciate based on relationships that we have forged. So a lot of those efforts are continuing, and we will keep the public informed. But for the time being, I think we're in a good position, given what we have and what we expect in the short term. So we have completed 3 weeks of the vaccination program, and on Wednesday, March 31st, 2021, we have inoculated 41,901 persons in Jamaica, and have received the first dose of the Covid-19, who have received the first dose of the AstraZeneca vaccine. The upcoming vaccination sessions for this week, we continue with members of the population 75 years and older. So that's our focus, and that's what the registration process, which we announced, the online and call-in, as well as through the NHF and the health centers. That's where they're going to place the bulk of their focus. We've seen some responses, but we would have liked to see more, and so we are deploying other methods to try to get the 75 years and over out. This vaccination blitz on Saturday will involve all that took place last Saturday, except an additional variable which will seek to respond to the hesitancy of that age cohort by deploying and coordinating with the political organizations in the respective constituencies across, in this initial instance, across 5 constituencies in the corporate area. So we are working with Members of Parliament Philip Paulwell, Members of Parliament Julian Robinson, Member of Parliament Angela Brown-Burke, Member of Parliament and Minister Desmond McKenzie, and MP Williams. Central Kingston, MP Williams. So what we have done is basically chosen 5 catchment areas, if you will. And we are working with the MPs and their organization, and they have an organization on the ground that has served them well. Clearly, they are members of parliament. They have been elected. With the electoral office to provide information on persons who fall in that age cohort, and working with them to give support, whether through town criers or mobilization support, to identify persons, but not just to identify persons, but to use that organization and the influence of that organization to convince persons on the value and the importance of coming out. So there's a little reasoning that have to take place. And one of the things that we've tried to do is to provide that support. Now, it's a template that we're trying. I know sometimes many persons are impatient that we need to move faster, but we don't want to roll out and create chaos. We want to be gradual initially and then expand exponentially across the country, knowing that the formula can work once we all understand it. And we believe that this new approach of embedding the leaders, the political leaders on the ground, giving them support, helping them to identify these persons, and encouraging them to encourage these persons to come out. We'll be interested to see how that works.